to move now and talk about what is going on. As you know, I wasn't here last weekend because I didn't feel very well. In fact, it's been a really unpleasant, whatever I've had has been incredibly unpleasant, very chesty and flu-like. And in fact, there has been a 352% increase in the number of people hospitalised with flu compared to this time last year. There's also real fears of what they're calling a quad-demic, which when you break it down actually there is a rise of a number of viruses, which you would expect at this time of year. You've got COVID, which has now become a much milder disease, but you've got COVID, you've got flu, you've got something called RSV as well in there, and you've also got Norovirus, which is a very unpleasant virus that makes you vomit. We are seeing vaccinations taking place for the elderly, vulnerable, those people who want to get vaccinated against flu. Interestingly, my own experience was I don't think I had flu. I've had a vaccine against flu. It wasn't COVID. I tested for COVID. I don't know what it was, but I felt absolutely ghastly. Joining me now, Professor John Oxford. It's always a great pleasure to talk to him, Emeritus Professor of Virology at the University of London. Good morning.
Yes, good morning, David.
So what's going on? I mean, honestly, I think I'm a pretty young and fit man, but last week I was absolutely incapacitated. I didn't have a high temperature. I did have terrible aches and pains. I felt absolutely lethargic, couldn't move. I've now developed a rather splendid chest. What is going on? There's this quad of viruses doing the rounds. What are you seeing on the ground?
Well, I think, as you say, everyone is seeing more respiratory viruses and more respiratory problems, but not fantastically more, I must say. I've been out and about quite a lot in London recently in the last few days, travelling on the underground, taxis and so on and so forth, and I don't get the feeling people are not coughing on the tubes, people are not coughing in the theatres. So that's what usually begins to happen when there's a big outbreak. So it's definitely not a big outbreak. And the question is it worse at this time than it was last year for these viruses? The question is, what are we going to do now? And just listening to you, actually, right at the beginning, cheered me up, because you said there's 2 more weeks to Christmas. And, of course, Christmas is the vital factor here, isn't it?
It is.
We have parties, we go out and meet people, we're travelling and all that sort of thing. Now, the 2 weeks gives us time, gives everyone time to get vaccinated. And the fact is, the National Health Service alone can never cope with this sort of thing. It just can't in any country. So everyone needs to be part of the operation, as it were. Everyone needs to help. And the patients, as patients ourselves, we can help by getting vaccinated. So
let me just push back on that. There is a real... I have been vaccinated for flu. I'm self-employed. I cannot afford to be ill for various reasons. The pushback from people, and I know what people will say, is that their trust was undermined by what went on in COVID, that we have seen people with side effects, adverse reactions, like my mum who got it to a COVID vaccine. Can you allay people's fears here about the flu immunisation programme?
Well, I can, because the flus, I've been in virology for many, many years, 40 years and more. When I came into virology, the flu vaccine was well established and it has remained so. So I quite agree with you. When a new virus appears on the scene, like COVID, we're all at 6s and 7s. That, you can't do anything else other than be at 6s and 7s. But with flu, everything's settled. We've had a lot of experience with flu. So I can reassure people that the vaccine is safe. And I can reassure people the side effects are very, very rare. So the thing to do is to pack up your bag, go and see a GP, or alternatively, go into a local shop, the chemist shop. They're vaccinating people as well. Obviously, if you're not in a risk group, as it were, if you're not over the age of, say, 60, 65, if you go to a chemist shop, you have to pay for it yourself. But GPs will be only too pleased to have people, their patients coming in who are at risk of getting serious complications from the flu, not from the vaccine, flu. So everything's ready for you. What we need is for everyone to make that move in the next 2 weeks, and it will not be time wasted, because I can tell you, when I came into virology, I did a rather nice experiment with some medical students. They volunteered with ethics committee approval. We vaccinated them, and we took lots of blood from them for the next 2 weeks. Every day, sometimes twice a day, we were taking blood from them, and I had a team of people analysing up blood to see how quickly those students responded to the vaccine. And I can tell you, it was stunning how quickly they did. No one had realised that up till then how quickly you do respond. Within a couple of days of being vaccinated, we could detect their changes in their immune cells, and they were beginning to be protected. That's why there's a period of 2 weeks now before Christmas, and it's definitely not too late to go on and get yourself vaccinated.
So, and you make a really good point there. It's not just actually feeling dreadful with the high temperature and the aches and the pains. It's the complications of flu, isn't it, that really can set you back.
Yes, and in those risk groups, the complication is you could die, and we're not messing around here. So we've got the experience in a typical flu year, and I don't know what this year is going to be yet. As you say, we've got a plethora of viruses out there competing. But they will compete, those viruses. They're Darwinian, like Charles Darwin thing, the survival of the fittest. They will compete. We can't tell at the moment whether COVID is going to come out on top, whether flu is going to come out on top, or possibly even RSV. So, but the thing is, you can certainly protect yourself against flu with the vaccine.
Yeah, go on.
Yeah, well, that was another point about this. What we have to do as patients, as it were, in the community, and not just sit around. And I was looking on the tube yesterday, and the hygiene level of people on the tube and indeed on the shops is not good enough.
No. But actually, this is something I've gone on a lot about in terms of public conveniences. There's never soap. There's never enough sort of hand washing facilities. And I think we need to improve that as a public health measure.
Yeah, and what we can do ourselves, seeing two men who were really, really not up to it, they were coughing they were all right, they were shielding their cough. They had a bad cough, both of them. And they shielded their cough with their hands. But the problem is, when you cough, you'll cough the virus on your hands. Then what are you going to do with your hands? Yeah. And then they were holding the seat and moving their hands around. So what you do is you cough into your arm like that, and no one's going to ever pick you up by the arm. And so it stops the spread onwards of the virus that you might have.
Really, that's a really good point. Can I just ask you about these viruses going around? So we've spoken about the influenza virus. We know about COVID, RSV. We're seeing a lot of RSV. Well, I don't know if it's a lot compared with where we should be. But who normally gets affected by RSV? I know that virus affecting younger people, kids, for example, and over 65s. Is that still true?
Yes, it is. And I can tell you the most fearsome thing, I think, for a GP, and two of my children are GPs, the most fearsome thing for them is we're looking after a baby who's got blue lips, having trouble in breathing, and the child has to get into the hospital. They found the hospital, and they said there's no space. And this was last year. And then my daughter said, well, he's got blue lips. And they said, right, bring him round right away. So it's a fearsome thing, RSV. In a way, for children, perhaps even more fearsome than flu. But there is a vaccine, again. The GPs are giving it out. But the new thing, the relatively new thing, is what I didn't appreciate at the beginning of my career, that we did concentrate on the children, but we forgot the adults. And when we looked into the adults, we found that there was a lot of respiratory syncytial virus moving around in the over 65s, and they were contributing to deaths in that group. So now, quite rightly, GPs and hospitals are focused both on children and on adults, particularly in the elderly group.
And also, so for a very youthful 55-year-old, could I have had RSV?
Yes, I think you can. You'd have to do better just to get on the website.
Well, I'm just interested. Just finally, if I may, we now have some antivirals up our sleeve, don't we, that can be used, certainly in the early stages, if you haven't been immunised, if you then get flu. Just tell us about that.
Yeah, yes, there are. There's a couple of antivirals, particularly one that was stockpiled, should have been stockpiled. Well, of course, we didn't have a flu pandemic, did we? But there are some reassuring antiviral drugs. One's only just been licensed this last year. So there's two what we would say are effective antiviral drugs against flu. And you can either take them to stop yourself getting infected in the first place. That's called prophylaxis. Or you can wait until you get yourself infected and as soon as possible take the tablets. One of the drugs, you only need one tablet. It's a bit of a miracle drug, really. So things have happened quite in both the vaccines and in the antiviral area. And I'm very pleased to report that to you.
Yeah, well, great news indeed. Thank you ever so much for your time. So good to talk to you, and I wish you a very happy Christmas. That's Professor John Oxford there, Emeritus Professor of Virology at the University of London.